Hi, I'm Cameron Allen. I'm a student nurse from Prairie View, and today I'll be performing your head to toe assessment. So first I'm going to start off with hand hygiene, and then I'm going to ask you a few questions. Could you please tell me your name? Winnie the Pooh. Okay, great. Could you tell me today's date? November 19th, 2020. Okay, great. Now, can you tell me if you have any pain anywhere? Okay, no pain. What about stiffness in the neck? Okay. Have you been feeling dizzy at all? No, not even when standing up? Okay. And have you been feeling tired lately or have any sense of fatigue? Okay, no. Well, great. Well, first, let me just check your pupil dilation. Okay. Just look straight at me. Okay, good. Pupils dilate and react to light. So next I'm going to check your posterior thorax. So basically I'm checking your lungs, but I'm going to ask you to turn around. So if I can assist you to turn around. Okay. And so just by inspection, skin color is consistent with ethnicity. No lesions or scars or any bruising. Spine is midline. First, I'm going to palpate. Now I'm going to palpate. Let me know if you feel any pain or discomfort. Okay. Any pain or discomfort? All right. So now I'm going to listen to your lung sounds. And I want you to take a deep breath for me, in and out, and let me know if you feel any dizziness or shortness of breath, okay? Okay, thank you. Okay, great. Lung sounds are clear with no adventitious breath sounds. So now I would ask if you could turn around. I'll assist you. Okay, to the front. And hold on, trying to, okay. And so now with checking your anterior thorax, just by looking, skin color again is consistent with ethnicity. No bruises or scars or lesions. So now again, I'm going to first palpate. Let me know again any discomfort. Okay. I know I didn't feel any hard masses or anything or lumps. So now I'm going to listen again to your lung sounds. Again, take a deep breath in and out for me. And if you feel any lightheadedness or shortness of breath, just let me know. Okay, good. Again, chest sounds were clear with no adventitious breath sounds. So next I'm going to check your cardiovascular system. And I'm going to be inspecting your neck, looking for any visible pulsations, which I see just a slight pulsation. I'm going to palpate your carotid artery. Is there any pain or discomfort in your neck? No? Okay. Okay. And your carotid, those sides are palpable. So now I'm going to listen to your heart sounds. Take a deep breath again and let me know if you feel any shortness of breath, okay? I'm going to start with your pulmonic, aortic, Erb's point, tricuspid, and the mitral. Okay, great. Heart sounds are sounding great with the diaphragm, but now I'm going to use the bell, okay? So I'm going to listen to the same spots using the bell. Pulmonic, aortic, Erb's point, tricuspid, and the mitral valve. Okay, nice. Heart sounds sound good. All are bounding. And so now I'm going to assess the abdomen. Just from inspection, skin color is consistent with ethnicity. The umbilicus is midline. No scars, lesions, or bruises. No visible masses. So first I'm going to auscultate. And now normally for the abdomen, we would put you in a supine position. Just like for cardiovascular, we would normally put you in a semi-Fowler's position. But for video purposes, we're not doing that. And I think it would be easier, to see. Okay. So let me do it like this so y'all can see what I'm doing. So I'm first gonna auscultate. And I'm gonna start in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Okay, vowel sounds are active. And now I'm going to switch it with the bell, and I'm gonna listen to the same thing. Okay, in the right lower, right upper, left upper, and left lower quadrant. Okay, vowel sounds again are active. So now I'm going to palpate. And first I'm gonna palpate lightly. Again, let me know if you have any pain or discomfort. Okay, I'm gonna start with the right lower, right upper, left upper, and left lower. Okay, no hard masses of any kind. Now I'm going to use deep palpation. Now this one, you might feel a little uncomfortable, but let me know if the pain gets too bad. Right lower, right upper quadrant, left upper quadrant, and left lower quadrant. Okay. I did that to feel for any internal, enlargement of any internal organs, which I did not find. The abdomen, your abdomen looks great. So now I'm gonna move on to your peripheral vascular system. And we're gonna start off first with the arms. Now just from inspection, the arms are consistent with ethnicity. No bruises or lesions of any kind or scars. From the touch, skin is furry, yet warm to touch. let me see about your capillary refill. Since our patient is our patient's fingers is covered with fur. But hypothetically, capillary refill is less than 3 seconds, which is good. Now let's check your radial pulses bilaterally. Okay, pulses I would give a 2. And now we're gonna move on to your legs. And so for legs, just by looking at them again, from inspection, I would say your legs, the skin tone is consistent with ethnicity. Again, no scars or lesions or bruises of any kind. Skin is warm to the touch, which is good. And since our feet is covered with fur, I cannot tell, but capillary refill, I'm gonna put it as less than 3 seconds, which again is good. So now I'm going to palpate your posterior tibia, okay, which is slightly palpable. And now your dorsal pedis. Okay, which again is slightly palpable. And from there on, we have completed your head to toe assessment. Thank you for being such a great patient. I appreciate it. Thank you.